Hello everyone, Namaskaram. Welcome to my channel, VPK Nutrition, Mind Body Healing with Pushpa. In today's episode, I'm going to be talking all about kidney health. Now, March is considered to be National Kidney Awareness Month, so I thought this would be an appropriate topic to cover. I'm going to discuss a little bit about what the kidneys do, what are some risk factors for kidney disease, what are some symptoms if you are in the later stages of kidney disease, and also give you some, kind of discuss some of the lab values, what they mean, and also talk about some tips to keep your kidneys healthy. So stay tuned to find out more. Welcome back, everyone. First of all, thank you to my viewers who've been watching regularly and liking them and commenting and all of that. I really appreciate it. Now, for those who haven't already subscribed, please do subscribe. If you like this video, share it with people that may be benefited. So let's get started with today's topic. So kidney disease, again, is prevalent in the US. Every 1 in 7 adult has kidney disease, which accounts to about 37 million Americans. So it is quite prevalent, and the two main risk factors are diabetes and blood pressure. So if you have diabetes and blood pressure for a long time, your risk factor is even greater for CKD or chronic kidney disease. Now, 1 in 3 people with diabetes and 1 in 5 people with hypertension or blood pressure are said to have kidney disease. Now, again, we're talking about those people who are not under control. And again, even if you're taking pills to control all of these things, it's very important that you also work on your diet and lifestyle to alleviate the symptoms and fix your body and make your body healthy. So you cannot be dependent on pills and medications all the time, because over a period of time, those things start to stop working, and then you're left with even more problems. So again, this is a very important topic because a lot of people live with this kidney disease without even knowing about it. And when they do find out, it's usually too late, or it's like stage 3 or stage 4 or even 5 sometimes. And then they're like in a lot of panic mode. And they find that even people who go on dialysis eventually in stage 5, only about 4% have seen a dietitian or learned about diet and lifestyle, because if they had done that earlier on, they could have actually helped themselves and maybe slowed down the progress of kidney disease, protected their kidneys, and may not even end up on dialysis, especially if they are much older in age. So these are some things to keep in mind. So let's see how the kidney helps us. Now, the kidney is the greatest filtration system in our body. It takes the impure blood, which comes in through the arteries from the heart into the kidney. It filters all of those toxins, and these toxins are moved through the urethra into the bladder and stored as urine. And then the good blood is again, the purified blood is again sent through the veins to the rest of the body. So this urine that is sitting there is again excreted to remove these waste products from the body. So kidney has a very important function that we need to keep us healthy. So I already discussed the risk factors. Diabetes and hypertension are big risk factors for kidney, but also old age, heart disease, and also certain populations are more prone to kidney disease than others, like the African Americans and Hispanic population and American Indians. There are also nephrotoxic drugs or even herbal medicines, whether it is Chinese medicine, Ayurvedic medicine, or any of those things, can cause toxicity. So you have to be very careful if you're taking any of these supplements, unless you're prescribed those by a practitioner and being monitored and taking it for a short amount of time. I would recommend not even trying those things on your own. And I see a lot of kidney patients in my practice, and some of them do take herbal supplements just because they Google it and find something is good, they start taking it, and you don't know how these things are going to affect your body. So it's very important to remember that. Of course, there are other risk factors. Sometimes autoimmune diseases like lupus and sarcoidosis and things like that can cause kidney disease. But we are going to be focusing on the chronic illnesses today. When it comes to symptoms, in the early stages of CKD, people may not even have any symptoms. In fact, even though the statistics are so high, in the US, 9 out of 10 people are not even aware that they have CKD, especially in the early stages. But in the later stages, they do start seeing symptoms. So what are these symptoms? I'm going to list them one by one. One, urinating more or less often than usual or having decreased urine output. Second thing could be itching, feeling tired, swelling in your arms, legs, or feet, muscle cramps, nausea and vomiting, loss of appetite, or even having a metallic taste in the mouth. Now, these symptoms that I just gave you doesn't mean immediately that you have CKD. Obviously, these are some clues to examine further. So naturally, you would do some lab tests. Now, eGFR or glomerular filtration rate is what gives us an indication as to if your kidney is working properly or not. Usually, a number of 60 and above is considered to be normal range. If it's between 30 and 60, you're supposed to be in stage 3 of CKD. If it is 15 to 30, it's considered to be stage 4, and below 15 is stage 5. Now, once you get to stage 5, usually your nephrologist will start talking about dialysis, especially if you have a lot of symptoms, it makes sense. But if you don't have a lot of clinical symptoms and you are in stage 5, you can still keep on going at the same pace and just have to make some changes in your diet and lifestyle so that you don't end up on dialysis. And usually my older population, let's say if they're about 75, almost even 80, I have a lot of old people because I see a lot of renal patients. I usually tell them, if you work on your diet and lifestyle, you can help yourself and you may not even end up on dialysis. You can slow down the progress of kidney disease or at least stay where you are right now. Now, the other lab values besides GFR are BUN and creatinine. So this is blood urea nitrogen and creatinine. And these are usually elevated because these are the metabolic waste after the breakdown of protein in the body. So generally, when you're eating a lot of animal protein, especially, a lot of urea and creatinine is formed and starts to build up in the blood if the kidney is not filtering it properly. So this is something we look at. And then of course, the GFR is calculated based on the creatinine values. So you want to make sure you decrease your creatinine if you are in that stage. Then other things to look at are potassium, which is a mineral also filtered by the kidneys. Generally, potassium is good for the heart, but when the kidneys stop functioning optimally, then the potassium starts to build up, and this can become dangerous if it gets too high. It can cause irregular heartbeat, EKG changes, and also stop the heart if it gets to over 6 or higher. So it's very important to be cautious about that. Then phosphorus is another mineral filtered by the kidneys. If the phosphorus gets too high, you might have a little bit of itching, and also it starts to pull calcium from the bones, again causing weak bones. Then sodium, of course, you have to restrict because, again, sodium is filtered by the kidneys and it increases blood pressure. And, of course, fluids, because all of the fluid that is in the body is also filtered through the kidneys. And if you start building up too much fluid, you're going to start seeing swelling of your feet and edema and all of that. So these are some things to understand about your own labs. Again, your doctor usually explains these things to you, but it's always good to have that knowledge. I've also shared a couple of links in my description for websites that talk about kidney disease and how to understand that for yourself, especially if you're in that stage where you think you may be at a risk factor or whatever. It's good to have that knowledge. I did share a lot of information about kidneys, risk factors and causes, and also the lab values. I would like to leave you with some basic tips that you can follow in order to keep your kidneys healthy. So let's see what those tips are. Number 1, keep your blood pressure under control. Now, I have shared a series of 3 videos talking about diet and lifestyle management to maintain optimum blood pressure. So please do watch those, and I will leave the link in the description. Number 2, keep your blood sugar under control, especially if you're a diabetic. The hemoglobin A1C of less than 5.7 is considered normal. Or if you're in the pre-diabetic range from 5.7 to 6.4, be extra cautious and bring it down with diet and lifestyle. I have done a video on diabetes as well, so I will put that link in the description. Number 3 is weight management. If you are obese or overweight, try to lose a few pounds, which will help with controlling your blood pressure, blood sugar, and also give you overall good health. Number 4, drink adequate water. Choose warm or room temperature water. Avoid cold or ice cold water. And when it comes to drinks, make sure you drink something like herbal teas like ginger lemon or other digestive teas versus sodas or sweetened juices. Number 5, avoid processed foods because they tend to be very high in phosphorus, and also sodas like dark colas, Coke, Pepsi, etc., and which are also high in phosphorus. Number 6, avoid high salt in your diet. You can use salt in cooking, but avoid adding extra salt at the table. Make your own spice blends and use them. I have created a video with the Kidney Foundation of Illinois talking about spice blends. I will share the link in the description. Avoid canned foods, processed foods, packaged foods, frozen dinners, and also soy and Asian sauces, which are very high in salt. Number 7, try more plant-based protein. If you are a meat eater, try to cut down the animal protein to 50% of what you're eating right now. Try to have more meals with plant-based protein, and also try a meatless day a week. All of these will help to decrease the load on the kidneys and protect them for a longer time. Number 8, make sure you have good GI function with proper digestion and elimination, because bowels are another way of getting rid of waste products from the body. If you do have constipation, I have done a series on constipation and how to relieve it, so please watch that. I will share the link in the description. Number 9, remain active. So make sure you do some kind of exercise for 20 to 30 minutes a day. If not in one straight shot, at least you can do 10 to 15 minutes after each meal. Number 10, keep stress under control. Yoga, pranayama, breathing, meditation, and oil massage weekly can help to control stress to a great extent. Number 11, make sure you get a good night's sleep. Have a sleep routine. Turn off the screens 45 minutes before bedtime and relax with some meditation before you go to bed. Hope you enjoyed today's episode. Hope you learned a lot about your kidneys and how to help protect them. Again, always live a mindful life, because that's what's going to really help you in the end. Listen to your body, observe your mind, and help yourself. And see you again next week at the new episode. Have a wonderful week ahead.